I meet that day, I want to make an impression on the way that they live their daily life. Whether it's just their child, who has been sick, or them, they've been given a diagnosis that they don't know what to do with. I try to make that manageable for them.
Okay. What are your communication strengths and what are your weaknesses?
Well, sometimes I do tend to stumble over words sometimes when I'm talking to people because I'm changing words to something. I was like, okay, maybe they're not going to understand me when I'm speaking this way. But it's all about trying to, taking very, very difficult information sometimes and breaking it down to however, someone's going to be able to understand.
Mm-hmm.
Someone who barely speaks, English is going to have a certain knowledge base of words versus someone that's been speaking English all their life. So you have to kind of change it up to kind of see, how they're going to be able to, interpret the information, because you want them to understand it correctly.
Mm-hmm.
Even when you come to children versus talking to their parents, how they're going to understand, or whether it's economics, someone who lives in a lower economic class versus someone who is in a higher, they tend to, understand things differently. So you have to change that up so that they can understand.
What do you think of, what are your weaknesses in communication?
Well, I would say definitely sometimes my words and wording. Sometimes I have to say things maybe more than one time in different ways for patients to understand. And sometimes it just takes a while in my communication.
How do you handle communication barriers?
Well, first you try to find out where they are. What is it that they're going to be able to take from your conversation?
Mm-hmm.
Whether it's someone who's deaf and you may need to write a few things out. I do know some sign language,
mm-hmm.
so I can do a little bit. So you can do that, but whatever it is, I know a little Spanish. I can get some basic information. I can understand more of the conversation than I can actually tell them. But I know how to use our system where we can call pharmacists who speak other languages that could be better at communicating this to someone than I can.
Do you plan on further continuing your Spanish learning?
Oh, of course, definitely. I mean, in the area that we are in, it's our second language, basically. Mm-hmm. So you have to, in order to, properly communicate with people, you're going to have to, meet them where they are. And so whether it's Spanish, still continuing my ASL, the sign language training, that all of that.
Any other languages possibly?
Well, yes, I do plan to pick up a little Chinese because that's where my daughter's been really trying to learn. So a few of that, and my family language is Creole French. So I've been, working on getting that as well.
Do you communicate differently with regular patients versus one-time patients?
Well, yes, you tend to, because you've built up a rapport, a relationship with people who are frequently in the pharmacy. As far as their care, no, you do try to give everyone the best possible care, but to ask more questions and what areas to ask questions in, and someone that you're able to meet all the time. Whether it's, someone's husband passed away, you need to know of, how to comfort them, how to, treat them more affectionately, as well as making sure all of their needs are being met. Someone who only comes in and wants, a lot of times they're just wanting, to know how to take this, how it's going to affect my life for the next 2 weeks versus my life all the time.
has age impacted on job communication? Like higher ups may be a little bit older than you are. How has that affected you?
So you say the customers or?
Yes, the customers. Like the customers are a little bit older. They can't hear as well. How has that affected communication?
Yes, that still goes into communication barriers. You still some of the elderly people you do know to speak, loudly, use less words. You need to direct your questions, straighter usually to get the information that you need. Younger children, same thing. Our young adult group, they tend to think they know more, but you do need to let them know the most pertinent information. Yeah, our older population has a lot of different barriers, whether it's economics, you need to notice if, okay, they're only getting this medication every 2 months, but they should be getting it every month. Then you figure out, they're on a very limited income, so you do a lot of inferences just to see, how you're going to, okay, how do I communicate this? How do I get them the best possible care? And you need to really look at people all over.
Has the retail pharmacy provided any kind of help um, with communication as of like languages? They print out like pamphlets or any kind of information like that?
Yes, all of our, we have, I want to say about 20 or so languages that we can print our information in, as far as the prescription label, as well as their refill information. All the medication information can be printed out in a multitude of languages. So that really helps in getting across to the people that you really can't speak to, and I mean, because you can't communicate as well, but you can use, kind of read their body language to know if they really absolutely aren't understanding what you're saying. Then you can get a pharmacist on the phone that does speak their language to really get it across.
Okay. That goes on to my second question. Body language. Did you learn through the profession how to read body language?
Yes. Sometimes when people are in the pharmacy, they're either they're angry, they're stressed, or they're really, really sick, they don't feel well. And a lot of times you're not being able to get the information from them to find out what exactly is going on with them. So you kind of have to read cues of how people are going to want to receive the information that they're giving you. It could be someone who's really shy, or it could be a very personal matter. And a lot of times the way our pharmacies are built, they don't have a lot of, area for you to just speak without other people hearing you. Yeah.
Okay. What should young people do to prepare for a job in this field?
You definitely have to do some research. The pharmacy is so big that you really have a very broad window of where you want to go, whether it's nuclear pharmacy, do you want to do clinical pharmacy, retail pharmacy, hospital, plain hospital pharmacy. So you have to kind of get a feel of what you want to do, where do you want to end up. You can add other things in a business degree. Helps, like if you're going to open your own pharmacy, or if you're going to be in administration in a hospital. So you have that, and that will all change how you approach your school, your education. So you do have to do some research, and once after you do a little bit of research, talk to people in all of those areas to see what it is that they like most, what are the demands of the job, what is it that you're actually going to be doing every day. So that's what's going to impact your life, and how you perceive your job usually. So you